So now this is a schedule for Cerebellum's Lab 2. What is the meaning of Lab 2? So basically in Lab 1, we have long classes. All of these are live classes taken by teachers, subject specialists. In Lab 2, we again take live classes, but these are more concise. And that is why we call it crash course. Why crash course? Because in itself, it's a complete course. Even if somebody is starting from here, it's a good start. And for those who have already done the earlier live classes, it's a good source of revision. So what are we going to do? Quick revision or rapid revision videos, right, are considered as one of the best ways of cracking the exam. The problem is, if you want to watch a 5-hour quick revision or rapid revision video, despite watching it at 1.5x, you end up taking 10 hours. Why? When you're watching a video, it is very difficult to remain focused. Your attention keeps on going here and there. Sometimes you start thinking about something and then you have to bring back the video. You have to take the video back and again start it. And in all that process, you waste time. We know that. This is true for everybody. Even for people like me, it's not so easy to watch long videos. And this is what Cerebellum has done. Live classes, live lectures solves this problem. Live lectures solves this problem. So what we're doing here in Lab 2 here, Mission 2.0, is we are kind of giving the same content as your rapid revision or quick revision videos, but in live lectures, right? So this is what we are going to do. We are going to start with pharmacology on 11th of March. That is when this batch starts. That is when the Lab 2 starts. 11th, 12th March. Classes started around 5:30 p.m. Usually 5-hour class. If you look at the rapid revision videos or quick revision videos of GRG sir, they are also 10 hours in duration, right? Here we are again teaching for 10 hours. Not only that, after the class is over, we have got a test and discussion on 13th March. So we give you 3 days to complete pharmacology. You don't have to watch the rapid revision videos or quick revision videos because GRG sir will be teaching you live. When you are studying live from a faculty, it is much easier to sit for 5 hours or 6 hours. Why? You have that FOMO, that if I'm doing something else, the class will proceed and then I'll find it difficult to catch it. So what we see is the students continue in the session. Majority of the students continue to remain in the session and they're able to complete the session. Live lectures, my dear students, is the hack to complete these videos. Otherwise, they are very difficult to complete, but in live lectures, you can do it. So on 11th and 12th, GRG sir will teach for 10-11 hours, complete the course. 13th March, there would be a test on pharmacology and then there would be a live discussion. Similarly, medicine, 4 days, 15th, 16th, 17th, 18th, and the 5th day you have test and discussion. Physiology, 2 days, test and discussion. Similarly, all the subjects are covered. In between, we have our BTR ENDs. Now, in BTR, one thing that I personally like is these combined test and discussion. Because these subject ENDs and Dr. Zainab's ENDs, they are the resources where you do not only the MCQ practice, but the art of solving MCQs. So these are very important. If you look at all the videos of toppers, all the interviews that we conducted, all of them speak very highly about these ENDs. The questions are made by the teacher, the discussion is done live, they help you with the MCQ practice. So a couple of subjects, then BTR END, a couple of subjects, then BTR END. Now, what do you have to do in the daytime? I am presuming you are somebody who's starting with the preparation. If you have been preparing, the second half of the presentation is for you. In the, say on 11th, you studied pharmacology from GRG sir. 12th morning, what you're supposed to do, you have to revise it. You have to revise it and you have to do the PYQs. You will go into the test section of the app. There are filters. You will look for late night PYQs. You'll scroll down and then you will find late night PYQs of pharmacology. Pharmacology 1, 2, 3, 4, 5. These tests you have to attempt. They are the PYQs of NEET PG, INI-CET, some FMGE questions as well. And they are subject based. Right? So in the morning of 12th and on the morning of 13th, you have to do those late night PYQs of that particular subject. Similarly in medicine, class in the evening, morning you revise it, and late night PYQs, which were the tests which have already been taken in the app, but you can again take them. Why am I asking you to take those older tests? Because they are subject specific and you are somebody who's just starting with the preparation or trying to get back into that preparation mode, right? Along with these live lectures, PPTs would be given, but again, I would advise that you use the quick revision notes of Cerebellum. They are quite in sync with these classes. In some subjects, there would be issues, but more or less, they are in sync. So, and then there will be some GTs in between. You have to appear for them. So, in this way, starting from 11th of March till 5th of May, almost 55 days, we complete the course and we have completed it nicely. If you look at the number of days given to all the subjects, and given the fact that the duration of a particular class on a particular day is 5 to 6 hours, what you would be taught would be quite close to what is there in the quick revision or the rapid revision videos. And I don't need to tell you that if you can master the rapid revision videos or quick revision videos, you are in a very good place. And then you would be doing all the tests and discussions, the BTR tests and discussions, and you are in a pretty good space. Now, 5th of May, after 5th of May, in the Cerebellum app, Marathon INI-CET would start. What is Marathon INI-CET? Before every major exam, for around say 10-12 days back, we have a 7 or 8 day session in which the entire course is revised, right? The schedule is in the later slides. But if you are starting your preparation now, or if you are not in a good space, then probably you will be preparing for NEET PG. So you don't have to start with the Marathon INI-CET. You have to continue to be focused on the NEET PG exam, which means, so I have already answered this. You have to use quick revision notes here. The late night PYQ marathons that you are doing would be subject wise. Please remember that while all these classes are going on, new late night PYQs would be given in the app. They would be mixed bag. They would be for those students who are already in the revision zone or who are doing revisions. If you are starting your preparation, then your late night PYQ should be subject wise. We also have certain grand tests. Now we are going to have 2 mock tests for NEET PG and 2 mock tests for INI-CET. And we are trying to do something new here. One of these mocks would be at an average level, the difficulty level would be average, and one of the mocks would be tougher, more lengthier. Similarly, for NEET PG, 1 mock average difficulty level, 1 mock tougher, because we want you to have an experience of solving both kinds of paper. NEET PG 2024, 1 session the paper was average, 1 session the paper was slightly tougher. They did all those statistical things, but the people who were giving the tougher paper, many of them freaked out, and because of that they got bad scores. So we want you to have some experience of attempting difficult papers as well. As I said, between 5th and 20th May, Marathon INI-CET would be going on. You don't have to attend it. You have to cover the subjects. In those 55 days, if anything gets left, you have to cover it. Same goes for the first 10 days. If you're watching this video on 1st of March or 5th of March, you still have some days left before the live classes start. Use those days. I would suggest that cerebellum surgery, quick revision videos, around 28 hours. Cerebellum's PSM videos, quick revision, around 9 hours. And biochem video of Dr. Ankur, again 9.5 hours. These are very high yield. And surgery especially, because during the live classes, we have given 3 days of surgery. So probably the live classes surgery would be lesser than what is there in quick revision videos. For us, almost all subjects, it would be quite close to the quick revision videos. But for surgeries, it may be less. So try to watch these 28 hours of videos either before the classes start or in those 15 days period. Otherwise, if you have covered everything, you can just revise. So now let's talk about the lab 3, which is Marathon NEET PG. So in Marathon NEET PG, what will happen from 22nd of May till 10th of June, like the last week, all the subjects would be again revised, right? This has been a problem that students read a lot of things, but in the end, putting everything together and revising in the last few weeks becomes a challenge. So this is what we do in Cerebellum. We are going to ask a teacher, we are going to request a teacher that, sir and ma'am, you have got a couple of hours, 5 hours for anatomy. In these 5 hours, whatever is important, whatever you think is the most important for NEET PG examination, let's teach that to the students. So see what happens is when you put all these legendary teacher, experienced teacher in a live class and give them a duration, that in 4 hours you have to complete pharma, in 5 hours you have to complete PSM, the kind of things that they pick are very high yield. And that is why these marathons have been a huge hit. So for bigger subjects like medicine, 9-10 hours, but for most of the subjects, 4 to 5 hours. For shorter subjects, 2 hours. And then there will be some mock GTs that I talked about. There will be some mega BTRs, which are the BTR tests taken by BTR classes or BTR sessions taken by Dr. Zainab, again for around 4 hours in duration. And this is how we complete the marathons. So if you are a student who is just starting or who is just trying to bring the preparation back on the track and primarily focusing for NEET PG, this is what you have to do. Start with the lab 2 classes, live classes, do the MCQs, late night PYQ marathons, subject wise, appear for the test and discussions, subject wise, appear for the test and discussions of BTR, study on your own for those 15-20 days that you get in between, complete the subjects, if possible, complete the quick revision videos of surgery, PSM and biochemistry by Dr. Ankur, and then for the final revision, join us back in the marathon. If you're not a student of Cerebellum, you can become one. Just go to the cerebellumacademy.com. In the plans, you'll find Mission 2.0. Subscribe to it. If you subscribe to Mission 2.0, everything that is happening in the app, you get access to it. Now, let's talk about the students who have followed lab 1 properly, done all the live classes, or who are in a good space, whose preparation is going well. What should they do? For you also, the lab 2 remains of course the same. Now, the thing is, if you have done the lab 1 classes, you have made the notes, you have the notes with you, keep those notes in front of you, and then do these live classes. You can have 2 revisions in the lab 2. How? 11th evening you have a live class, 11th morning from your notes you revise it. From your notes you revise it, and in the evening you have a live class. So you're having 2 revisions simultaneously. This is something that FMG students told me. We have a similar mission 200 plus program in FMG, and they told me that in the lab 2 in the evening they would have class, in the morning they would do it on their own, and that's such a great idea. In the morning do your revision from your notes, in the evening you have a class. So you are having 2 revisions while lab 2 is going on. So live class, ENDs, and then after a couple of subjects are done, BTR ENDs, the same sequence that we saw in lab 1. So lab 2 would be for around 55 days. 55 days is a good duration of time for your revision, and if you do it properly you can have 2 revisions, and this is going to go till 5th of May. What about the late night PYQs? Now in this lab we will be giving mixed bag late night PYQs. They will now become mixed bag, which means all the subjects will be put together so that you have a more examination like feel. The number of questions would be around 40, 50 or 60. We might add midday PYQs as well. The midday modules would be discontinued in this lab because now we have to focus more on the PYQs as we are moving towards the exam. So we'll have to calculate the number of questions available, but these are going to be mixed bag. Notes, you have to continue with the same notes whatever you use in the lab 1. I'm hoping it is either workbook or quick revision notes. Just continue with it. Keep on highlighting with different colors. Keep changing the colors, because when you sit for the marathon classes, try to focus on those things which you have marked in this lab 2, right? So that the lab 3 marathon lectures become even better, sync with the notes. We will have 2 mock tests for INI-CET, 2 mock tests for NEET PG. 1 mock test would be average in difficulty, 1 mock test would be more difficult, more lengthier. This is true for both INI-CET and NEET PG. We want you to have a feeling, we want you to have a feel of both types of exam, like it happened in NEET PG 24. In one session, the examination was average in difficulty. The second session, more lengthier, more difficult. A lot of students got so anxious looking at the difficult paper that they messed up the paper. We want you to have some practice before you go for the real exam in case something of that sort repeats. So on 5th of May, we are completing with the lab 2, and then we start with the marathons. We know that in marathon, INI-CET, before the exam, we are going to cover the entire course again, focusing on the INI-CET specific topics. All of us know that in INI-CET, certain topics are asked more frequently. And that is why we have a separate marathon for INI-CET. The idea is in a span of around 7-8 days, in around 80 hours, try to cover everything, try to revise everything. This has been the problem for most of the students. They read from various sources in the last 2-3 weeks, they are not able to put everything together. And that thing is done by the teachers here in live lectures. You ask somebody of the caliber of Dr. GRG or Dr. Vivek or Dr. Ankur, all of them great teachers, to complete the course in a couple of hours, and what they come up with is something that is of very high yield quality. That has been the strength of marathon classes, and in the previous batches, marathon classes were loved by everyone. They said that the classes helped them a lot in the exam. I'm sure that same thing is going to happen in this session as well. So for the bigger subjects like OBG, we have more hours dedicated. For shorter subjects, we have lesser hours dedicated, and this is going to be the schedule for marathon INI-CET, right? And after INI-CET is done, I think it's on 17th of May, we will start with the marathon NEET PG. Now marathon NEET PG is slightly different this year because we have got more time, 22nd May till 15th of June. We have gotten more time. So rather than putting all the subjects together, we have spaced it out so that you get enough time to revise also. So subjects are taught, but evening hours are left for you to revise. And this is a mistake. The bigger subjects would be continued till 7 p.m. Shorter subjects 2 hours, most of the subjects 4 to 5 hours, bigger subjects 8 to 9 hours, right? So one subject or maximum 2 subjects in a day, so that you get more time to revise also, right? So this is the plan, guys. And finally, what I can say is we still have like 3 months, 3.5 months or 100 days with us for NEET PG, and 1 month less, like 2 months for our INI-CET examination. If we use these days properly, and if we are able to take our preparation to that next level, a lot can change in these last couple of weeks. Please do not think what has happened till now. It is immaterial. There is enough time left. Don't waste even a single moment asking yourself that is enough time left or not. It is, believe you me, there is enough time left. You have to use this time properly. Again, I would remind you of the question. 10 to 12 hours a day, 9 out of 10 days for the first 50 to 60 days, and then 12 to 14 hours a day, 19 out of 20 days, which means 1 day break in 3 weeks, 1 day break in 10 days. If you can do this, I promise you, you would get surprised with your results. Study hard and your ranks will surprise you. This is one of the most important exams of life, and the effort that you're going to put should also be special. All the best. May God bless you all.